Thank you so much for meeting with me today, Dr. Scopu. We are extremely excited about the Ultimate Smile Extravaganza, who's able to go and who's eligible for it and what it involves. So if you don't mind, I'd love to ask you a few questions.
Yes, go ahead.
All right. So who is orthodontic care for, and what age should people start worrying about whether they need braces or liners?
That's actually a great question. So really there is no age limit. So I start seeing children very young. We're starting early, as well as patients that are old in their 60s, 70s, even 80s, believe it or not. But what we're trying to do is kind of improve the overall alignment of the teeth. Why improve the teeth? Because when the teeth are in a better position, you're really conserving. You're saving the dental dentition. When the teeth are in the right position, they function very well. So not only do you look great, but also functionally you're in an excellent position, which long-term saves the teeth. So as you age, that's what's happening. But the orthodontic event is for anybody, young, old, whoever wants to join us for this event. It's for them, because what we'll be discussing specifically is treatment tailored to their needs at whatever age that is. So it'll be geared to you specifically or to those patients specifically. So anybody can come to the event, really.
Fantastic. All right, and what are some of the most common dental issues that orthodontics can address?
So obvious, maybe crowding. You see someone crowded teeth, but maybe spacing. What about an underbite? So someone with an underbite where the teeth are a little bit more forward like this, or overbite when there's too much teeth showing, the teeth appear too far forward, so too much overjet in the teeth. At the same time, wear. So let's say you have worn teeth as you age, a lot of wear. So sometimes we want to put those teeth in a better position so that we preserve and the teeth don't longer wear, or prepare them for orthodontic restoration. So restorations after orthodontics to improve back the function or bring back the function that was lost.
Okay, so in addition to the orthodontics, you can also work with the restorative after.
Absolutely. As we age, that usually tends to happen because the teeth are in a poor position and they're not in a great position to begin with. They tend to wear over time, and so as they wear over time, the teeth tend to break, or super eruption of the teeth get shorter or appear shorter in general. And so sometimes we want to intrude those teeth, bring those teeth back up to create space to bring the teeth back to where they once were. Align the teeth and then bring back the space that was lost from the wear to restore back to their natural dentition, to the natural way the teeth used to be.
So it's not just side to side movement. You can move teeth up if there's teeth that seem longer as well.
Absolutely, yeah, that's another one. Sometimes because we have too much super eruption of the teeth, or the teeth are coming down too much, showing too much teeth, we want to move those teeth up, or sometimes we want to move them down because they're too far up and we need to move them back in a better position. Rotations can be fixed with orthodontics.
So teeth that are like twisted, like I've seen sometimes. I know I used to before my braces have some rotated teeth.
Rotations, crowding, obviously. Spacing. What about spacing? Sometimes, you look at someone's teeth and maybe two front teeth look big and the side teeth look small. So maybe there's a tooth size discrepancy. The teeth are a little bit off. And that way we can also reshape the teeth, maybe make the two centrals a little bit skinnier and close the space, harmonize the smile. Or what about if there's spacing and the teeth look too small? Maybe we make even spaces so they can be ready for veneers. So there's a lot of places or a lot of situations where we can use orthodontic treatment, definitely, in not only just crowding or spacing or underbite, overbite, but other situations as well.
That's great to know. How do crooked or misaligned teeth not just affect the appearance of the smile, but the actual oral health, the function as well?
Absolutely. So we touched on wear, that's one aspect, but if you have crowded teeth, it's very difficult to clean. If the teeth are totally crowded, it's very difficult to clean. So you're getting a lot of plaque buildup. If you get a lot of plaque buildup, higher risk of you getting cavities. So more frequent cleanings, more costly treatment maybe later, because if my bite is not aligned, a lot of times I see teeth break. So teeth can break, and now we have to do more expensive treatment. Maybe you need to do a root canal. Maybe even break the tooth bad enough that it's underneath the gum line, and then you have to extract the tooth. So that's another consideration, really, for treatment.
Wonderful. What signs should adults look for in their own smiles that might indicate that they need orthodontic care, braces, or Invisalign?
So, crowding, misalignment, wear of the teeth, maybe a gummy smile. The teeth look too much like too much gum is showing. Teeth are too far forward. They appear too far forward. Lip incompetence. What that means is, like, if I want to close my lips, if I'm straining to close my lips, you know. Sometimes if you have your mouth open, your airway kind of keeping your mouth open, you're breathing through your mouth. Those are other conditions that you want to consider orthodontic treatment. So that's pretty much, I think.
Okay. So I would think the people want to know what specific benefits will someone receive when they come to the Ultimate Smile Extravaganza.
Well, that event is really, it's our first time doing that kind of a big event.
Okay.
What we are doing at this time is promoting, obviously, orthodontic treatment, getting promotion. We're getting $500 off of any orthodontic treatment, free bleaching with all orthodontic treatment, and retainers at the end of orthodontic treatment. So all of that is included. Plus, we are giving away $1,000 off of any anterior restorations.
Really?
So let's say, like we were talking about the spacing or the crowding or maybe worn teeth, and we're making space in order to restore the teeth back to their natural way they used to be. We're giving a discount off of that. So in total, there's really about $3,300 off in total of everything on that day. So it's really, really a special day. We don't do it all the time. It's a once in a lifetime opportunity to take advantage.
It sounds super comprehensive too.
It
It's
is
not
super
just the
comprehensive,
ortho,
yes.
But you're doing the restorative after. So I
Yes.
think that's
Yes.
wonderful. That's a great deal.
Yeah.
3,300?
Yes, yes,
Wow.
yeah. It is our biggest event so far.
All right. And how does the iTero scan work, and how does it help during the consultation process?
So yes, if you're coming in on that day, a part of the consultation is an iTero scan. It's a digital scan, so that's awesome. There's no impression material. You come in, we'll take a digital scan, and what this digital scan will help me do is give you a few versions of this, give you a look of how the teeth are going to be when they are straight. So you'll get an immediate visual of here we are now today versus what it would look like when the teeth are straight. So you get that immediate visual at the time of the appointment. And Invisalign also has this new Smile Architect feature where we're not only, let's say you were that kind of case that needed restorations, I would also be able to set up the simulation to show you not only what the teeth would look like straight, but if you want to see what they would look like restored as well. So you'll be able to see all the different versions by taking that iTero scan. So for us, that's critical. We'll be able to look at your spacing, crowding, misalignment, straighten the teeth, and also, if needed, to restore the teeth, you'll be able to see that version as well.
Fantastic. So people can actually see what the end result will look like.
Absolutely, yes.
That's awesome.
It's amazing.
And how can orthodontic treatment improve long-term dental health? And why is it important that we start sooner rather than later with braces or Invisalign?
So let's start with, I feel like there's two questions here. One question is, why is it important to start sooner? So part of this is the growth aspect. So when you are young and you put force on the teeth, you actually get development of the jaws, which is an ideal case scenario. Develop the jaws to create a proper bite. So that's why you want to do it when you're young. The other part of the question, I believe, is dental problems with relations to not moving the teeth or having a bad bite. So some problems are long-term wear, which we know wear is an issue. cavities or plaque buildup or periodontal disease all can relate to bite. Another thing that can be related to bite is TMJ problems, so TMJ, headaches. So there's a lot of aspects that we need to be looking at with relation to the bite. The bite can affect many other conditions in the mouth, not only just movement of the teeth, straight teeth, not straight teeth. So it's very important to start when you can. Earlier is better, of course. Treatment is for everyone. You can start at any age. And then we would definitely design and cater the treatment based on what we see in your current condition.
All right. What makes this event unique, and why should people take advantage of it?
This event is unique because it's the first time we are doing an orthodontic restorative combination, specifically a combination event where we're giving discounts on orthodontic and restorative treatment, because a lot of times we are seeing adult patients and they need, in conjunction with orthodontic, they need some restorative treatment. So this is the first time we are doing a combination event, and that was, I think that's where the savings are coming in.
Yeah, very comprehensive. What a great deal. How can people take the next step if they are interested in attending or learning more about the Ultimate Smile Extravaganza?
Well, I believe in the link below you'll find some more information with regards to the event, and it is only a one-day event. It's January 18th, 2025, so it is a one-day only event. So you do want to make sure that you book your spot today. There's only 19 spots available, so it is very limited. It is very exclusive.
Yes.
And if it's something that you're interested in, you should definitely call the office today and schedule that appointment.
I'm sure those spots will fill up fast. $3,300 in savings.
Yes.
So when people reserve their spot for the Ultimate Smile Extravaganza, what can they expect that day?
First of all, it's a really wonderful event. We really plan well for the event. So when you come in, you will be guided by an assistant to your treatment room. We will do a scan for you at that time, and then I will meet with you. We are going to design your case right then and there. You'll get to see your treatment, orthodontic, possibly orthodontic restorative. At that time, we'll go over your specific treatment plan, and we'll go over all the savings that you could get that day only. We do offer financing for that day. We offer 24 months no interest with Care Credit, or 12 months no interest with Cherry, which is an amazing deal for that day, in conjunction with the savings. Yes, you can use your insurance. So people might ask me, well, can I use my insurance? Yes, you can use your insurance as well, as long as you have orthodontic benefits. And that day will also be entered in a very nice gift basket. It's about $250. It's beautiful. And you'll get a free gift bag with all the appointments set up that day.
Look at all those gifts in addition to the $3,300.
Yes,
that is awesome.
And of course we want you to accept treatment, but you'll still get to take all the gifts that we provide that day.
That's awesome. Wonderful. Thank you so much for sitting down and meeting with me.
Thank you.
I'm sure the patients are going to be very excited, very happy to see what the event brings, and we're happy to change smiles.
Yes. Thank you so much. Thank you.